Okay, we're going to go ahead and get started. Thank you so much for joining the webinar. We are very excited to be talking with you all about working with Continuums of Care, specifically for anti-trafficking organizations. Just to get some housekeeping out of the way, every participant is muted. If you have questions throughout the presentation, feel free to add them in the chat. We'll be sure to monitor those. And any question that is not answered within the presentation, we will have a Q&A at the end. So please feel free to add your questions throughout the presentation, and you're also welcome to share your questions once we get to the Q&A portion. If you have any technical issues, feel free to reach out to Avantika. She's keeping an eye on her email and will be helping us with the technical aspect of the webinar. She's put her email on the chat box. It's avantika@freedomnetworkusa.org. Okay, we're going to go ahead and get started. We have three great presenters today that are going to be chatting about Continuums of Care. We're very excited to have you all join us and learn a little bit more about what these are. If you are not familiar with the Freedom Network Training Institute, we are the training arm of Freedom Network USA. We do web-based trainings, and we also have a resource library that is available for all service providers that are working in human trafficking, and outside of that as well. We have a technical and training a training and technical assistance project specifically to address housing for survivors of trafficking. So you will continue to see these webinars that touch on issues around housing and also thinking about practical solutions, especially within systems that we may not be tapping into as regularly as we could, such as specifically like Continuums of Care. So we're very excited to be able to start kind of bridging that gap between what services exist and what we have already tapped into. Today we have the opportunity to hear from three speakers. We're going to be hearing from Jasmine, Jill, and Martha. Jasmine Can is the Executive Director of the Anchorage Coalition to End Homelessness. They are the lead agency for the Anchorage Continuum of Care in Alaska. We also have Jill Bolander-Cohen. She is the Executive Director of the LIFEBOAT project, which is an anti-trafficking organization in Central Florida, and it's a member of the Central Florida Continuum of Care. And finally, we have Martha R. She is Executive Director of the Homeless Services Network of Central Florida, and they are the lead agency for the Central Florida CoC. So today, you can expect to hear more about how that collaboration has worked, as well as some practical solutions that they've implemented in order to better serve survivors of trafficking through that CoC. And you'll also hear the word or the acronym CoC. We're referring to Continuums of Care. Obviously, it's a longer phrase, so if you hear CoC, we're going to use that interchangeably, so just be aware of that. After this webinar, we expect that participants are going to understand what a Continuum of Care is, the purpose it plays, and what the importance is of having anti-trafficking programs involved with Continuums of Care. We'll also be addressing practical ways to connect and how to best participate within your local continuum. We want to go ahead and just get some information about you and just understand how familiar you are with your local Continuum of Care. So if you could take a moment and just make your selection. Are you currently an active member of a Continuum of Care? Have you heard of a Continuum of Care? Or are you not familiar with Continuums of Care or CoCs? Go ahead and put in your vote now, and as we get those in, we'll be sharing the results. Okay, perfect. So as you can see from the results, we have a little bit of a mix. The majority seem like they have heard of at least of a Continuum of Care. A good portion are not very familiar with a Continuum of Care, and there are a couple who are active members. So it's good to have a mix, and we invite you to, as we go through the presentation, feel free to share with all other participants in the chat box, anything that you may have found helpful any resources or just any practical information or steps that people can take in accessing their continuum. So we're going to go ahead and start off with Jasmine, who's going to give us an introduction to what continuums of care are, and we'll go ahead and hand it over to her.
Thank you. So I think we start off the conversation by talking a bit about what the Department of Housing and Urban Development defines as a COC, or a continuum of care, because this does come from the federal level. So essentially, the concept behind a COC is to bring the community together and coordinate local homeless services. As no doubt most of you on the call are familiar with, sometimes we get pockets of excellence in a community, and when there is high community demand or community events that have caused an increase in the need for services, we are not always fantastic at a grassroots level about connecting to services and making sure that there's some sort of overarching umbrella that helps clients to navigate different services, but also helps the system to better function. So when HUD created this concept of continuum of care, the idea was targeted towards reducing homelessness, promoting long-term housing stability, but there are three core components that we'll talk about throughout this process this morning. And those three core components are the community-wide planning, that is an inclusive planning process that doesn't just look at housing and service providers. The idea of coordinating existing resources, again, to better serve people experiencing homelessness, but also to look at community-wide data collection and, for obvious reasons, performance management. Next slide. Every community has a different complexion within its COC, and we'll talk a bit about that this morning. A COC can include nonprofits in the community, law enforcement agents, both with juveniles and with adults, different public housing authorities, state and local government, of course. And in many communities, we also work to partner with social service agencies, faith-based groups, and oftentimes local businesses or interested people in the community. Again, if we think about services in communities, particularly those that are resource challenged or don't have political momentum behind this type of work, it really does take a grassroots effort. And so for each of you that do work around trafficking or work around homelessness or both, I would encourage you to seek out your COC, because most of my counterparts around the country are always looking for different voices to represent different dimensions to the work. And it truly is intended to be a partnership that is constantly evolving based on community need. Next slide. Different communities have structured their COCs in different ways, and HUD has provided some flexibility to those of us who do this work. So in some communities, a COC is defined by the geographic perimeters of the city itself. In some communities, it's by county, and in some communities, you have a mix. Most, in fact, states have a mix, where your urban pockets are often defined as an independent COC that operates in that particular concentration of services. And then you have what we have all adopted the phrase for as balance of state, and it's basically everything else. Next slide. I think Alaska is a fantastic example of the city versus balance of state. For those of you that are not familiar with Alaska or with Anchorage, we have about close to 50% of the state's population in Anchorage. However, our state is approximately 3 times the size of Texas. And if you spend some time thinking through some of the geographical constraints, we have one road system that does not hit the majority of our communities. Many of our rural communities are only accessible by plane or boat, and sometimes only accessible when the river freezes. And we have immense challenges with not only the topography, but the spread of our citizens across the state. I work very closely with my counterpart who is in charge of the balance of state. And so while I focus my work on Anchorage, and he focuses his work in our rural communities and some of our smaller towns, Juneau and Fairbanks in particular, we recognize that more often than not, we share the same clients. because Anchorage is a hub community, most people who are struggling with some type of vulnerability will end up in Anchorage. If your children are involved in a child welfare system, if you have any involvement with corrections or the justice system, if you need advanced medical care, or if you need access to different types of social or behavioral health services, you are likely to need to come through Anchorage. So we see approximately 60% of the people who have high need coming through our doors. However, my counterpart who manages the balance of state has his own unique challenges. HUD defines homelessness as a very literal definition, if you will. And they really look at who are people who are sleeping in places that are not considered appropriate for human habitation. An example could be a sanctioned or an unsanctioned encampment, someone who lives in a car. But if you're couch surfing, you don't always meet the definitions that a COC has to operate under in terms of literal homelessness. And I bring this up because my balance of state counterpart has a rampant problem with overcrowding. We know that in some of our rural communities, we can have up to 16 people living in a one-bedroom home. And the cost of living in rural Alaska is tremendous. The cost of building new homes is tremendous. But in small, close-knit communities, people are not likely to let their neighbors remain unsheltered, particularly with our 10 months of winter. So people will share their homes, which makes it challenging from a COC perspective to truly define the full scope of the challenge with homelessness in Alaska because of some of these definitional restrictions. I do want to pause for a moment. We're going to talk more about the interplay between homelessness and human trafficking in a few minutes. But I like to point out that human trafficking is on the rise in Alaska, and there's many layers to why that is occurring. Covenant House International, which is a nonprofit that focuses on youth and young adults and supporting them through a variety of different points of vulnerability, did a study, and that study included Alaska and Anchorage specifically because of our traffic and volume. And what they discovered is generally, internationally, we see that 1 out of 5 young people who are vulnerable are preyed upon by traffickers in one capacity or another. What we found is that in Anchorage, at minimum, it's 1 out of 4 young people, which is a slightly alarming statistic. We've also Covenant House, in partnership with the Alaska Institute for Justice and in partnership with our local FBI unit, have actually produced some figures that close to 75% of our young people who are experiencing homelessness are trafficked. And again, I think the layers of challenges we have with our urban versus rural population and the chronic poverty and chronic abuse and chronic substance abuse challenges that we have in Alaska all compound with this issue. But I like to talk about that briefly because not only do COCs need to partner strongly with different services and different sectors in the community, COCs also do a lot of work partnering with one another. There's some natural efficiencies there, but in the end, it's also what's best for our client because, again, Alaska being an extreme example, we tend to share clients. Next slide. Unpacking what a COC is truly responsible for can be complex, and sometimes, unfortunately, it's funding driven. So we'll talk a bit about how funds come into a COC from HUD, but essentially we're charged with 3 core tasks in a community. So the first, and this is a buzzword that HUD and folks that work in homelessness tend to use, but the phrase is homeless response system. And essentially that's the continuum of care. And the idea is a COC should be responsible within their geographic perimeters of understanding what is the landscape at play. Who are the key stakeholders that do the work in the homeless response system. And once they've identified the key stakeholders who do the work or better yet, need the assistance that comes out of that work, the COC is charged with doing at minimum an annual assessment to determine what the gaps are. And then of course there's some funding administration, and we'll talk about that in a few minutes. There's also a relatively new development with HUD, and that is a development that came out of 2017, and it's this concept of coordinated entry. I think the easiest way to unpack coordinated entry is thinking about triage in emergency services in our healthcare systems. So when you come in and you meet with one person, and that one person is able to do a basic assessment with you and determine what type of services you will likely need to get back to a healthy state of being. The idea behind coordinated entry was to connect the pockets of services that are available. Those could be mainstream resources that anyone in the community can have access to. Those could be specialized services that are only available to specific subpopulations of people. But coordinated entry is a relatively new idea. Different communities have chosen to evolve the system in different ways. But essentially, it's a process to shepherd people to the services that would best meet their needs. And finally, a COC is charged with managing the Homeless Management Information System, frequently called HMIS. This is a database, and it's intentionally, well, in its origin form, was really used to provide some basic reporting to HUD. So there is data that is extracted out of the system that is provided to our federal partners at Housing and Urban Development, and that's used for not only performance management, but to determine the need of a community so HUD can allot appropriate funds to that community for the COC. Again, different communities have chosen to ramp up their HMIS in different ways, including data sharing, including folding in different pockets of data, but we will talk more in detail about that in a few moments. Next slide. I want to go back to that first bullet point on the previous slide and think about this idea of understanding the homeless response system. A core piece of that, beyond just the data, is to really promote the conversation with all partners around planning. And starting with what are the gaps, and of course we would ideally use data to inform that, but also thinking about what are the resources that are available to the community. I will pick on my home community of Anchorage. Our homeless services are primarily funded through philanthropic donation and community goodwill. We have limited funds that come in through HUD, through the COC. We have limited state and municipality funds, but this work would not get done without donors, which means that as part of our COC planning, we really need to bring funders and donors into the conversation and talk about where our data is showing gaps are and where we need to further invest based on the changing needs of our community. Of course, this involves a lot of coordination and integration. Sometimes, and I don't think this is a novel experience just for Anchorage, but sometimes we do have services that are vital in the community that just haven't fully been tapped into, that people haven't connected the dots or connected the referrals, which goes back to coordinated entry. And finally, our world in social services broadly is moving very strongly to evidence-based practices and outcomes. And so as we think about innovations happening in homeless services, as we think about new programs that are being developed internationally, one of the ideas behind a COC is to not only improve data collection to understand need, but also to talk critically about what's working and what's not in the local community. Next slide. So I mentioned HUD funding, and again, the resources that are available to a COC can sometimes define, actually most of the time, will define the level of depth that the COC is able to go into some of these activities. At bare minimum, every COC engages in an annual NOFA process. A NOFA is a HUD term for the Notice of Funding Availability. Once a year, HUD releases a NOFA application for COCs and asks the COC to apply for annual funds. It's a two-step process at minimum. There is a community application where in most communities, all of the folks that are involved in the COC come together and do a group application on behalf of the COC. And this community application is what HUD uses to produce a score that, based on a variety of different data metrics, determines how much money will come into that COC for the upcoming year. Once the community application is in its final stages of submission, the COC will then create a local application for any agencies that are interested in applying to the overarching funds. So in some ways, the COC is a conduit of HUD funding. Again, I'll use Alaska as an example because our population is low. We bring in a little bit more than $3 million a year through the COC from HUD. That money does not generally go to funding COC business, if you will, though portions of it can help support administering some of this work. The bulk of those funds go to community agencies that are providing homeless services in the community. So when we think about the idea of community planning as a core responsibility for a COC, there's some clear connectivity to funding. The idea being that as a community, if you come together and say, our biggest unmet need in our community are the chronic homeless who tend to, in Anchorage at least, end up in our encampments or long-term in our adult shelters. If that is what we determine is the core gap, then the incentive is to make sure that your community application to HUD reflects that, and that your project application for any interested parties in your local community is very clear that you're looking to fund projects that fill the gap. So the idea, in essence, is that every year this process evolves so that the funding is continued to be focused dynamically on the greatest need in the community. There's, of course, many levels of gray in terms of the process and how it's colored. Sometimes there is unmet need that is not something that would qualify under HUD's umbrella. Sometimes the unmet need is vastly greater than the availability of funding, but there is an annual process. It is a community-wide process. And then as you can see on the slides, every year HUD identifies bonus projects that you can fund in addition to your normal ask. And what was particularly exciting for those of us that are passionate about ending trafficking is that in 2018, that bonus funding was targeted directly at agencies that support ending human trafficking and any type of domestic violence intervention. Next slide. I talked briefly about the homeless management information system, and I think again, in the world of social services, we are turning our attention to data, we're turning our attention to data sharing and all of the levels of complexity. I do want to point out that HMIS is not a nationwide system. So different communities have chosen to invest in different technology platforms, different vendors to manage this. So the systems do not all link to one another. And in some communities, they're not even statewide. So Alaska has made a concerted effort to have a statewide system. And as you can imagine, with releases of information and privacy practices, that can become complex. The data is really intended to allow monitoring, managing, and evaluating. There's also data that goes in there for coordinated entry for those referral processes. However, there are definitely communities that are looking at things like data warehouse capabilities, and that have had the infrastructure and the ability to invest in something more robust. However, the vast majority of communities are still focusing on this bare bones HMIS data, what's required both to function and to continue reporting adequately to HUD. Next slide.
Great. Thank you so much, Jasmine. So we want to definitely take away that data is important as far as being able to represent the need in the local community. One of the things that we want to make sure that you take away from this webinar is that victim service organizations, specifically, thinking about anti-trafficking organizations and programs, you are prohibited from entering client data into HMIS. So that is prohibited by the Violence Against Women Act, as well as the Family Violence Prevention and Services Act. We want to make sure that that's very clear, because as you access and collaborate with a continuum of care, you're going to hear HMIS data come up a lot. And I know that has definitely been a tension in the collaboration and the work that the domestic violence field has been doing for a while. And so we want to definitely learn from their lessons learned and understand how they've been able to work through some solutions. And really the solution is that you will still provide data. So just know that as a service provider participating in a continuum of care, you will still provide data, but it will not be through HMIS. It will be through a comparable system. Also, it will be aggregate data, so it's not identifiable, and this is for confidentiality, right? We want to make sure that the confidentiality of survivors is upheld. And so think about this such as TIMS, using TIMS in OVC funding or TDAP. So use your raising hand feature if you have TIMS fund, or excuse me, if you use TIMS through your OVC funding or if you receive TDAP money through your program. If you know, go ahead and raise your hand, and that way we can know how many people are already engaged in those systems. Okay, so there's a number of you that use this. Basically, think about this as a very similar way of providing that aggregate data that does not contain identifiable information. So if you're in the anti-trafficking field and you're receiving funding to serve survivors of human trafficking, very likely you're receiving funding from, if it's federal funding, it's going to come from OVC or it's going to be from the TDAP program. So we'll want to make sure that you, as a service provider, know that it's going to be a similar process. We just want to be sure to have a realistic expectation of, as you come into these conversations with Continuums of Care, being able to navigate kind of what the expectations will be and ensure that there won't be any challenges moving forward. We don't want data to be something that excludes or precludes people from actually engaging in this type of collaboration. Also, I think Debbie Fox, thank you so much. You just shared some information with all attendees on the federal statute that's written into VAWA and FIPSA, so that should be helpful. And we encourage all attendees to share this type of information, things that you find useful in working through these challenges or in working through the collaboration. Feel free to share those in the chat box for everyone to learn as well. Okay, we're gonna go ahead and get to the next slide. And so this is to summarize this section and just to understand kind of what you've gathered from what we just talked about. So as a whole, are anti-trafficking organizations required to provide data if they participate in a continuum of care? So you have one or two options. Of two options, yes or no. Go ahead and put in your answer now, and we're gonna share the results. Okay, so we're sharing results now. So it seems like we have mixed answers, definitely a little confusion. And yes, there's absolutely some gray zone as understanding, are we providing data, are we not? The answer is yes, we are providing data. We are not entering data as victim service providers into HMIS. Remember, this is really to deal with confidentiality. We are providing aggregate data on the survivors that we serve that does not have identifiable information. So yes, expect to provide data, but it will not be through HMIS. Think about it as the systems that you already have in place, either if you use OVC, you know, something similar to TIMS, or if you use TDAP, using those reporting mechanisms. We just want to make sure that that's very clear for you. Okay, we're going to go ahead to the next slide. So next, we're going to hear from Jill and Martha. They are part of the Central Florida COC. So we're going to hear about how LIFEBOAT, which is an anti-trafficking organization, has worked with the Central Florida COC to best meet the needs of survivors there. Martha?
Great. I'm excited about this opportunity to talk with you about our COC and about our partnership with LIFEBOAT, and just really appreciate any opportunities and the interest of the folks on the webinar about how to tie human trafficking in and the continuum of care and how we can partner better together. LIFEBOAT is within the catchment area of the Central Florida COC, so they're in Florida, very different from Alaska. So Alaska has 2 COCs. In Florida, we have 27 continuums of care, ranging in size. Our continuum of care covers 3 counties, basically around Orlando. So it's Orange, Osceola, and Seminole counties that are here in Central Florida, with Orlando being the dominant city between the 3. And we've got our continuum of care is approximately 40 or 50 agencies and individuals who work together. It's any stakeholder who is interested in ending homelessness is encouraged to join the COC and be one of the members. And as Jasmine had discussed, we have a lead agency, and in the Central Florida area, the lead agency is the Homeless Services Network of Central Florida. And so that's where the work is getting done here. So next slide. As Jasmine mentioned, there are lead agencies who are kind of the liaison between the partnership between all the providers in the region and HUD, the kind of the funnel of where communication goes back and forth between the local communities and HUD. The lead agencies can be a city or a county government, or they can be a nonprofit organization. They could actually be the balance of state. It could be a state government entity. In our case, the lead agency is a nonprofit. And a lot of the work that we do, that lead agencies do in addition to coordinating the required activities of a continuum of care that Jasmine talked about, a lot of the work that we also have to do is to coordinate the grant funding and compliance, including data collection. And this is a super important issue for folks to be aware of. In the recent application that was discussed, the recent bonus application for funding that could be targeted for victims of human trafficking or other domestic violence victims, the communities where most of them were applying for funds, you don't get to just use the funds any way you want. There's certain activities, there's certain eligible activities you can use the dollars for, and that included what's called rapid rehousing. That was the dominant option that communities were going to be able to apply for funding. So throughout the entire organization of HUD, of its entire portfolio, everything from public housing to Section 8 to this continuum of care stuff, HUD has identified rapid rehousing as its project, as its program that is most vulnerable to fraud. And so they are really sticklers now, and they develop a lot of compliance around that project to try and minimize that risk. And so the lead agency and the continuum of care have to work with agencies to ensure that projects are able to administer those dollars in a way that complies with the HUD guidelines and the HUD requirements, so that no agency gets in the awful position of actually having to pay money back. That's the last thing we want anybody to do. So that whole compliance with HUD contracts and making sure that agencies that are receiving HUD funds kind of know what they're signing up for and have the capacity to effectively administer the dollars is also an important role that your lead agency plays, that the continuum of care plays. And another piece of this is building the partnerships to improve services. And I think there are a couple of things that are critical in that way. One of them being, as Jasmine was saying, we have to use community partners because the HUD money is not going to fulfill every need that the community has. And in particular, HUD really wants their money spent on housing. I mean, they are the Department of Housing and Urban Development. They are not the Department of Services. And so their preference is that communities spend their money on housing. And there's kind of an unofficial guideline, unofficial rule, that no more than about 20% of a community's portfolio should go for services, or else you kind of start losing points on your application and you're less likely to be funded. So in most continuums of care, the vast majority of the dollars has to go for the actual housing, whether that be permanent supportive housing or rapid rehousing, whether that's operating for a facility that's providing permanent supportive housing, whether that is paying landlords rent so that people have a place to live. But in our region, easily 70% of our HUD money is actually going to landlords and others to pay for housing, and just a small percentage, only about 20% of our dollars, are paying for services. And so in most communities, the service need is great, and so partnerships have to exist to make sure that there are other players who can help fund the services when HUD brings the housing dollars into a community. So we have to be careful. We want to, Continuums of Care are eager to try and maximize the resource, maximize the dollars coming in from HUD to make sure communities have those dollars, but HUD's not going to fix everything, and they're not going to pay for everything. And so then building strategic partnerships for funding, and also strategic partnerships to make sure that people who are put into housing have all the services that they need. All of that's a critical part of what your lead agency is going to try to do for the community. And the other piece of that is that we are really building systems that are working together. So you see that with the coordinated entry system, where we're prioritizing services, the homeless management intervention system that is trying to make sure we're able to really track trends and outcomes across our community. Increasingly, HUD is encouraging the Continuums of Care to, instead of having agencies operate in their individual silos doing their own things, that we're pulling together to operate a system that can maximize our responsiveness to our most vulnerable neighbors. So that's what our Continuum is doing, and that's what the role of the lead agency is, to kind of facilitate all those processes. Next slide.
Thank you, Martha. It is such a pleasure to be with everyone today and learning more about the CoCs. The Lifeboat Project is a nonprofit, and we provide housing, training, wraparound services to help victims of sex and labor trafficking. We're one of the only human trafficking agency service providers in Central Florida focused on the housing with a lifetime continuum of care. So when I got started in going to a CoC, I always knew that Maslow's hierarchy of needs was the basic needs: shelter, clothing, just the basic things in life. And the Lifeboat focused on how do we do this. So we had heard about a CoC where the agencies gathered together, but so many of them were focused on housing the homeless. But I've always made the claim that most all of our survivors are homeless, and they do need special care. We believed in a housing first model, providing housing and then providing the wraparound service. We just didn't know what it was called until we got involved with the CoC. Next slide. The need for collaboration. We got involved about 3 years ago, and we wanted to have a presence within the network and network with other agencies. This was crucial. We know that those that are running human trafficking agencies, over the years has been little to no funding. And so making people aware that human trafficking is even happening, especially within some of our homeless shelters. So sometimes we felt like the odd man out sitting at the CoC meetings, but over time, we got to really talking about how important it was for human trafficking agencies to be present at this. We networked and really got ourselves involved. The old saying goes that sometimes you're never too old to learn something new. And I really believe that, because 3 years in, and I still am learning things about being a part of a CoC. In addition, there's monthly meetings that we go to, or you should go to, I will say that. There's other active committees. There's allocation and coordination committees, shelter provider committees, which we attend, planning committees. And then what is getting ready to happen, maybe Martha or Jasmine can talk more about it, is the annual point in time count, the PIT count. So this is important. This is another important thing that's happening with us. Next slide. What were some of the initial challenges? Well, I guess was getting people to understand that human trafficking is alive and thriving within our communities. And really forcing a seat at the table to say you have to take this serious. We need to provide really specialized services like we do for our veterans or those with the chronic homeless. A lot of our survivors are just in constant trauma. And so I think HUD, we've noticed over the last few years, is really starting to have special funding out there for the agencies. And we're just creating more awareness within the COC and working together on that. So let me see, next slide. One thing that I think is extremely, extremely important is collaborating and attending meetings consistently. I cannot stress that enough. Sometimes people say, well, I'm not getting anything out of the COC. My response is, how many times do you go to the meetings? Well, maybe once a year. Okay, that's not enough. You have to be present and you really have to work together. And you have to join the committees, getting involved, get your staff involved in going to the different committees and speak about the needs of the human trafficking survivors. The wonderful thing about at the COC meeting is, especially with Martha, because I am in the Central Florida COC, is they are really good at keeping us abreast of what is going on. And this is so important. Opportunity for funding through the NOFA. So if you're focusing on housing or transitional housing, this is a great opportunity, especially now with the bonus money that has come out. Next slide. The outcomes of collaboration, awareness of the needs of the trafficking survivors, increased referrals. There is an agency here, the Coalition for the Homeless, and I cannot give them enough kudos, because when Lifeboat Project has been in a pinch to find a survivor immediate housing, they have gone over and above to accommodate us. And that is not normally possible if you're not building these relationships. And through the COCs, it is, this is how we've built this great friendship and collaboration over the years. So that comes in with increased partnerships in local community and increased housing services. Next slide.
Okay, so now we're going to go back to Martha, and Jill, also feel free to chime in as well. Add some very practical steps on how to access the local COC. So for service providers that are listening to this webinar, what are some concrete steps that they can take to begin to form that collaboration?
Absolutely. As you see, there's a link here. You can go to the HUD website, and it will tell you about the various COCs in your state, what counties or what part of what COCs, and it'll give you the contact for your lead agency. And so the first thing you want to do is contact your lead agency and ask them for information about joining the COC. Sometimes different COCs have different membership processes. Sometimes you just have to fill out a piece of paper. Some of them have a small fee to join. Some you don't have to fill out any piece of paper. You just show up at meetings. So you want to learn what the process is to becoming a member and get on their distribution list to make sure that you are aware of the various meetings and opportunities that they have. Learn what the different committees do to find out what's the most strategic option for you. COCs are also very likely to conduct training throughout the year. Some of those trainings you may find beneficial to participate in, but you may also be able to help lead some of the trainings. So there'll be trainings, most likely your COC is going to offer training, kind of skill building training, things like here in Central Florida, we regularly offer trainings on motivational interviewing and on trauma-informed care and harm reduction and different styles of service modality, particularly evidence-based best practices. But we also find that our providers can help provide training on those topics or inform them, training on working with the LGBTQ community, cultural competence, things like that, that can be helpful. So you can take on a leadership role in many cases, as well as being a participant. And you can make sure that the COCs are designing their system so that they are sensitive to and maximizing the COC's ability to work with victims of human trafficking, whether those trafficking victims are specifically being served by your agency or are being served by the larger homeless community. There's no doubt that there's a lot of human trafficking victims throughout, all being served by all of the agencies in our community. And Jill and LIFEBOAT's participation in our COC has helped raise that awareness, has helped make other providers in our community much more sensitive to that, and improves those quality of services. So you're going to come to the table, you want to come to this table, you want to know who your COC is, know who your lead agency is, get involved and know that you're coming there in hopes of accessing resources for your population, but also because you bring a good resource to improve the quality of services for all human trafficking victims in your region. Next slide.
And Jill, if you want to follow up with the tips for anti-trafficking service providers.
I guess it's just a recap here. Representation is key. Show up to the meetings. You need to get involved. The PIT count, like I said, is coming up. Martha, I don't know if you want to talk a little bit about the PIT count. This is also an area too where when they go out to do the PIT count, point in time count, and you can potentially run across victims, human trafficking victims that are there. And so again, having that greater COC to network with, especially in the cases of emergency, are important. Martha, did you want to tell them a little bit about what the PIT count is?
Sure, that's a good point. The point in time count is every COC is required to conduct a point in time count during the last 10 days of January. And so it's coming up in your community one way or another. And it's usually coordinated by the lead agency. Sometimes it's done by somebody else, but usually the lead agency is going to coordinate that. They're always looking for volunteers. And whereas some COCs, like our COC is fortunate that we have street outreach workers working year-round throughout our communities, our counties, and looking for folks who are out on the streets year-round. In many COCs, this may be the only time during the year that there's a real intentional effort to go out into the streets and into campsites and into the woods and looking for people in abandoned buildings, etc., to identify where people are sleeping outside, where the unsheltered homeless population is. And so this is a great opportunity for you to volunteer. It could go either way. You may be helping, they may be helping you know about places, and you get a chance to interact with unsheltered homeless people. But there may also be kind of hot spots, places where you know victims of human trafficking may be located that your continuum wasn't previously aware of, and therefore they haven't been including them in the annual count. And so this is one way that HUD evaluates the effectiveness of what's going on in your region, is comparing your annual point in time count. It's not necessarily the best way, but it is a way they do it, but it is an annual event. Communities aren't required to do the street count every year. Sometimes they can do it every other year, but most do it every year, and it's a great opportunity for you to get engaged with your continuum.
And as Jasmine spoke earlier about the Covenant House, they are a very, very active participant in our local COC here. And so during this time of the PIT count, especially when we talk about runaway homeless youth, this is giving us access to, are there victims that are out there, and how can we collaborate together? One other thing is the HMIS system will come up, and remember that you're required to use a comparable system to report aggregate data. Next.
Wonderful. Thank you so much, Jill and Martha and Jasmine as well. I think the information that you've provided has been extremely helpful in getting us acquainted and introduced into continuums of care. I think as you've heard these three speakers share about their experience and also just the benefits of accessing and being involved with a continuum of care, you'll see how the benefit is truly mutual. For Continuums of Care, they have, as new anti-trafficking organizations participate, they also, that includes and bolsters up their referral network and the type of organizations that they have. Also, we're sharing a very much real need of who the anti-trafficking survivors are, and just being very aware that there is a population of survivors who are, either have housing instability or are homeless. And so it's very important for us to be present to be able to share that information. I know that a number of questions came in through the chat, so we'll go ahead and take some time to address those. If you have questions on Continuums of Care or on the strategies that were used to collaborate and begin those partnerships, please feel free to enter them into the chat, and we'll go ahead and address those. So I think the first one that had come up was around utilizing the VI-SPDAT with case numbers, not names, to the coordinated entry system if you get client consent. So we'll open this up to the COCs as well as Jill, but just, I'm not sure if this was a question from a service provider who's working in an anti-trafficking program or someone that's working more in the homeless system. I know that the VI-SPDAT is used very often as an assessment tool. I went to a training with the founder of the VI-SPDAT, or the person who created it. He said it was actually meant to be a triage tool for to triage and be able to prioritize the services and the housing that was available. At least I haven't seen in the anti-trafficking world that being used. Housing assessment is part of service provision, and oftentimes it's centered around the needs of the survivor. So I would say if you are a service provider in the anti-trafficking field and you have questions about the VI-SPDAT, even if it's a case number, I would suggest working with a person within your continuum of care or someone that's more familiar with this system. So that would be extremely helpful, especially just understanding that coordinated entry, a lot of organizations and people within those organizations have access. And so again, the confidentiality question comes up. So
and I would just add to that each continuum, I'm sorry, this is Martha, each continuum is different in who operates the coordinated entry system. Sometimes it's a lead agency, sometimes it's somebody else, but you want to be in touch with whoever's doing the coordinated entry system and talk to them about what their strategies are for ensuring that victims of human trafficking and other domestic violence victims are able to access resources through that coordinated entry system. So communities come up with a variety of ways to do that, and so you want to just talk to them about what their strategies are. And those can be challenging conversations, but they're good conversations to have. And you can also, your community can also request technical assistance from HUD specifically on issues around coordinated entry and victims, and how to make sure that that process is as seamless and as smooth as possible. As smooth and seamless as possible.
Thank you.
This is Jasmine. Just to piggyback on that, I think there's often myth busting that we do, and anytime I hear VI-SPDAT and coordinated entry, I cringe a little bit on the inside. HUD does not mandate that that is the tool that's used. And I think you've heard from all of the presenters today that engagement is critical in the health and well-being of a COC. I know that in Anchorage, we are currently undergoing a year-long plan to look at our existing coordinated entry system and figure out what's working and what's not and how to improve it. And one of the core pieces of feedback I hear from the community is that the VI-SPDAT tool has limitations. It is a self-report tool. Depending on who administers it, how, when, what their relationship is with the client, how frequently the tool is administered, you will get different outcomes. And the reality that our victimized neighbors don't change their vulnerability levels as they continue to remain in circumstances where they may be homeless or they may be experiencing the after effects or current effects of trafficking is pretty one-dimensional. And so there is no requirement we use VI-SPDAT. There is a requirement from HUD that we have a tool that allows us to assess someone's vulnerability, but communities do have that flexibility. I think in terms of sharing scores for any assessment, that's really going to depend on your local community's data sharing agreement and how broad or how specific the release of information documentation is, and again, those data sharing agreements. But I think sometimes we pass the buck on to HUD when in reality, there is a lot of community control and flexibility, and there are TA services that are abundant. And if we're not doing right by clients, come to the table and advocate for the people that you see every day. You know, I'm so proud of our community for being brave enough to say this isn't a tool that's working for us in the way it's currently being administered. And so let's think about how to change it. Of course, the change management of that is pretty exhaustive and it's hard and disruptive for staff and for clients, but the juice is worth the squeeze if you're finding that this isn't meeting the needs of your community.
Wonderful, thank you so much. This next question is also for for Jasmine and Martha. So it says, just to clarify, agencies that are part of a COC are not necessarily funded by HUD, is that correct?
Correct. The majority of the agencies that are members of our COC do not get HUD funding. Some do, but most do not.
We have about 50 member agencies and 20 board members, some of whom represent providers, some of whom represent tangential and important stakeholders. But we fund less, I think we fund 7 different projects, some of which are housed in the same organization. So just because you're not funded doesn't mean that you don't need a voice at the table and a voice in community planning and direction. HUD defines funding pretty narrowly, so we don't always have the luxury of funding what we think is the best service in the community, but being part of that conversation and helping to prioritize where the money needs to go is still very powerful.
Thank you. The next question that we have is, are you seeing an increase in collaboration with VOCA funds that are being allocated to transitional housing for domestic violence and human trafficking survivors? And that's to all panelists, if any of you have experience with that or have seen any of that collaboration with VOCA funds. And VOCA funds is the Victim of Crime Act, and that comes through the Office for Victims of Crime.
This is Jill. No, we haven't seen anything. Martha, do you?
We partner with agencies that receive VOCA funding for domestic violence, but not yet for
human trafficking. Right, yeah.
Thank you. Okay, it looks like those are all the questions we currently have. Just as an update, we will be having a follow-up call to this webinar, which will take place on February 28th. It's going to be a follow-up technical assistance call. So as you begin to implement some of the suggestions that were mentioned today, as you begin to make those collaborations and try to bridge that gap, you can bring to us any sort of questions that you have. The panelists from today will be on that call as well to help you troubleshoot and think through some of the potential solutions that you can implement as you move forward with this collaboration. We know it's extremely important to be present at the table, and continuums of care are just another way to expand what access we have for survivors of trafficking in accessing additional opportunities for safe and stable housing. We know that housing is one of the #1 priority or the #1 priority for the majority of survivors. So we want to ensure that we have options and that we're aware of what those options are, so that way a survivor can choose what's the best fit for them. As you'll see in the following slide, just how to get in touch with us. As we said, the follow-up technical assistance call will be February 28th. If you registered for this webinar, you're going to receive a follow-up email that will include that information as well as the recording and the slide deck. You are also welcome to visit our website at freedomnetworkusa.org. There you'll find the resource library that has an archive of all of the sessions that we've had to date, and also we'll continue to upload all new sessions, webinar sessions on housing. If you have any questions, feel free to reach out to us at training@freedomnetworkusa.org. And we would love to see you in the next webinar. That's going to be in March, but of course, join us for our technical assistance call on February 28th. If you will look at your chat box, we have a short survey. We would love to get your feedback and just hear what you have to say and how we can best continue to implement these webinars. So if you will take just a couple moments and click on that survey link, that would really help us out. Thank you again for being part of this webinar.